one of the things that I've struggled with as an anxious person is starting to exercise or to get back into exercising. You know, many of the same sensations you experience with exercise, sweating, pounding heart, increased heart rate, they're all the same symptoms of panic attacks. Do you have any advice for people suffering from anxiety or mental health issues on how to get started getting their body moving without feeling that anxiety and fear?
Honestly, mobility is a great way to get started into that. I talk about this conversation that we have to have with our body. With a conversation with a person or with yourself, there's two parts to it. There's what you're saying to yourself, and there's a listening aspect. What is your body telling you? So if you're saying to yourself, I have to work out because this person's telling me, or I have to feel like this, or I hate my body, it's fat, or any of these negative things, that's probably going to help create that anxiety. It's going to lead you to a path of unhappy. And when you start to feel those symptoms when you're working out, it's not going to feel good. So I always start with, what is the conversation that you're leading in with your brain? Are you telling yourself that you get to work out, or you get to move because it feels good afterwards, or you have this amazing body that is able to do it? So start talking to yourself in a more positive way before you even start to move, even if it's just a walk is where I would go to. So say, I'm going to go for a walk because my body's able. I'm going to go move a little bit, or I'm going to go try this workout because I can, and because it's going to feel amazing. So start with that positive conversation within your mind first, and then start listening. And it's okay to feel whatever you're going to feel. So if your body starts feeling like, oh my God, my heart rate is going up, remember to breathe, and that this is only supportive. So, oh, my heart rate's going up because my bloodstream is going through, and it's actually helping my heart to pump through more blood through my body. And as it does that, it increases the oxygen, and I'm able to exercise my heart, which is actually a really good thing. So if we start to look at these things that are happening within the body and tuning in and listening and coming at it from a more like, oh no, this is actually a good thing. Oh no, this is actually supporting me. And it's also okay to say, this is scaring me in this moment, and I'm going to take a step back. So if you're in a workout class, go to the back, step out for a moment, take a breather. No one is judging you. The hardest critic we have is ourselves.
So it's like a combination of this positive attitude, kind of changing your perception, and also having a very clinical look at it. Like, this is just my heart rate raising because of this bodily function.
Which is a great thing, and it's a positive thing. And I would also suggest moving slowly. Never just jump into something because you're like, okay, I have to work out. They told me that I have to move, and it's going to make me feel better. So I'm going to go to this workout, and it's going to be super hard. That would be so overwhelming.
And then you'll quit, right?
Yeah, most likely.
That's the whole New Year's resolution thing that happens to so many people, right?
Exactly.
So you feel kind of like mobility training is like the gateway drug to getting into more intense cardio, weight training, things like that down the line?
Yes, because it's only going to support you. Once you do start lifting, once you do start cardio or anything else, you're going to have this body that isn't going to be in so much pain afterwards, and is probably going to help prevent injury. Because that's the other number one thing that causes people to stop when they start automatically just going into heavy workouts, is that they get injured. Because if you haven't been doing anything and you're sitting in chairs and you're not moving your body or getting it into those end ranges of motion, and then you go try to squat, it's most likely going to cause pain, and it could even cause injury.
Now, this question comes from my sister, who is a runner. She runs all the time. But how about mobility for people like me and her who work at a desk all day and don't often get to stand and move as much as we might like? What's a good way for us to practice mobility in those cases?
I like to spread mobility out throughout the day. I am such a busy person, and it's hard to say, okay, I'm going to do an hour of mobility every day. Like, for me, that's just not reality. And for most people, that is not reality, especially when you're working a long job and you have to sit there and be in a chair all day long. So instead, I say, what are the little tools that you can start to bring into the office every day on a daily basis? And what are some things, like one mobility exercise you can start with before you get out of bed? A few that you do when you're at work. So every time you get out of your chair, you're going to open up your chest. You're going to open up your hip flexor. Every time that you're going to go to print something out or make a copy, you're going to do a squat, and you're going to hold that, or you're going to do a forward fold if you're in like a tight dress and you can't squat. You're going to do something that takes your body into these ranges of motion that you haven't been going into. And if you start doing that every hour, even once every 2 hours, something that's getting you up and moving a little bit more is going to be the key to getting into this mobility.